Hello dear learners. Through this video, we will understand the concept of equity and why it's so important in healthcare. In this video, we will understand the meaning of different terms like equity and inequity. What is the difference between these terms? Then we will discuss inequity in detail, keeping the focus on various features and factors responsible for inequity. After that, we will learn about the various aspects of equity. Like what is the need of equity? What are the types of equity? Different approaches to achieve equity. And how it facilitates access to healthcare. Most of the times all of us get confused between the terms equality, inequality, equity, and inequity. The concept behind all of these terms relate to the distribution of resources, opportunities, rights, and treatment within a society. They represent different ways in which individuals and groups experience their positions and access to various aspects of life. Equality is sameness. It refers to the state of being equal, where individuals or groups have the same rights, opportunities, and treatment without discrimination based on factors like race, gender, or socioeconomic status. Inequality means unequal. It refers to a disparity or lack of fairness in opportunities, resources, or treatment among individuals or groups, often due to factors such as social, economic, or demographic differences. Equity is about fairness and justice, ensuring that individuals or groups receive resources and opportunities based on their specific needs. Inequity refers to an unfair or unjust distribution of resources, opportunities, or treatment among individuals or groups, leading to disparities and imbalances in society. Let us make it more clear with an image. As it is visible in the left side of image, the resources are distributed equally among all with an assumption that equal distribution will benefit everyone. But in actual, boy A does not need that support to watch the match and boy C is still unable to watch. This equality where we distribute resources without considering the need or requirement. Equality is equal treatment. Now, if you can right side image. The resources are distributed in the way that everyone is benefited. This is equity where we distribute resources on the basis of need. This is a concept of affirmative action. We can take one more example here. Imagine a hospital with two patients who have different medical conditions and needs. Patient A requires a regular bed for a minor illness, while patient B needs an intensive care unit, ICU, bed for a life-threatening condition. Equality is giving both patients the same type of bed, regardless of their medical condition. One regular bed and one ICU bed. Whereas equity is allocating beds based on the patient's medical needs. ICU bed for the critical patient, regular bed for the patient with a minor illness. Next is the difference between inequality and inequity. Inequality is unequal distribution of resources, opportunities, or treatment among individuals or groups, often due to factors like socioeconomic status, race, or gender. Example, unequal pay between genders. Whereas inequity is unfairness or injustice resulting from systemic or structural biases that create disparities, leading to unequal outcomes. Let us understand inequity with an example. Consider two job applicants with similar qualifications, but one comes from a privileged background with personal connections to the hiring manager, while the other comes from a disadvantaged background without such connections. The person with connections gets the job, despite the other candidate being equally or more qualified. This demonstrates job opportunity inequity, as personal connections and social advantages led to an unfair advantage in the selection process. Now, if we want to differentiate, both terms form the view of healthcare. Healthcare inequality is differences in healthcare access, quality, or outcomes based on various factors like income, race, or location. Example: limited access to healthcare services in low-income communities. And healthcare inequity is unfair disparities in healthcare outcomes caused by systemic factors such as discrimination or unequal resource distribution. Example: racial disparities in maternal mortality rates due to unequal access to quality care. We have already discussed what inequity is. Inequity refers to differences which are unnecessary and avoidable but, in addition, are also considered unfair and unjust. Next is the features of inequity. First is systematic, which means that inequity is deeply embedded within the structures and norms of a society, leading to unequal outcomes for different groups of people. Systemic inequities arise from long-standing social, economic, and political factors that result in disparities that persist over time. Let us understand with an example. Imagine two neighborhoods in a city. One is a wealthier area with easy access to hospitals and specialist doctors, while the other is a low-income neighborhood with limited healthcare facilities and few doctors. As a result, residents of the wealthier neighborhood have better access to healthcare, leading to improved health outcomes. Second feature is inequity is avoidable. It means that inequity refers to unfair disparities that can be prevented or corrected through intentional actions and changes in policies and practices. Like in the previous example where healthcare access is unequal between a wealthier neighborhood and a low-income neighborhood, this inequity is avoidable by implementing policies that prioritize equal distribution of healthcare resources, improving access to medical facilities in underserved areas, and ensuring affordable healthcare for all. The disparities can be reduced or eliminated. Next feature is inequity is unfair and unjust. As in the above example, it's unfair and unjust that residents of the low-income neighborhood face limited access to quality healthcare solely because of their economic circumstances. Various factors contribute to inequity are income, gender, education, social status, disability, and urban-rural differences. Income inequity arises from disparities in earnings among individuals or groups, leading to unequal access to necessities, education, healthcare, and opportunities. This discrepancy stems from uneven wages, limited job options, and systemic biases. Addressing income inequity entails fair wages, safety nets, and economic prospects for marginalized groups. Gender-based inequity results from societal norms and biases, leading to differential treatment and opportunities. This bias favors one gender, resulting in unequal pay, limited leadership roles, and constrained choices for women. Addressing gender inequity involves challenging stereotypes and promoting equality. Educational inequity stems from uneven access to quality education due to socioeconomic status, race, location, or disability. Schools in low-income areas may lack resources, skilled teachers, and activities. Addressing education inequity requires funding, teacher improvement, and equal access for all students. Social status inequity occurs when some groups enjoy more advantages, respect, and opportunities due to their standing, wealth, or connections. This leads to uneven access to resources and power. Mitigating this requires policies promoting equity and challenging hierarchical norms. Disability-related inequity emerges when those with disabilities face barriers in education, employment, healthcare, and public spaces. Addressing this involves inclusivity in design, accessible technology, anti-discrimination laws, and valuing diversity. Urban-rural disparities occur as urban areas access better services compared to rural regions. Solving this entails rural development, infrastructure improvement, equal service access, and balanced growth policies. Now let's move to health equity. Equity is fairness. Health equity is ensuring that everyone has a fair and just opportunity to attain their highest level of health, regardless of their background or circumstances. It aims to eliminate disparities in health outcomes and access to healthcare services among different groups. Why equity matters? Equity matters because it upholds fairness, ensures equal opportunities, and honors human dignity. By addressing disparities based on factors like race, gender, and socioeconomic status, equity promotes social cohesion, economic growth, and public health. It aligns with ethical principles, leading to a more just and inclusive society that benefits individuals, communities, and the world at large. And if we talk about the need of equity in healthcare, equity in healthcare matters profoundly as it strives to ensure that every individual, regardless of their background, has access to the same quality of medical care. By addressing disparities in healthcare access and outcomes, equity promotes better overall health for all, reducing preventable illnesses and deaths. Equity is of two types: vertical equity and horizontal equity. Vertical equity focuses on treating individuals differently based on their level of need or advantage. This means that individuals with greater needs or disadvantages receive more resources or support to ensure fairness. For instance, patients with life-threatening illnesses might be prioritized for organ transplants or specialized treatments. This is an example of vertical equity, as the allocation of resources is based on the severity of medical need, ensuring that those in the most critical condition receive the necessary care. Horizontal equity emphasizes treating individuals equally if they are in similar circumstances or have similar needs. This principle aims to avoid discrimination or unequal treatment among individuals who are similarly situated. It suggests that individuals with the same medical condition and needs should receive the same level of care, regardless of their socioeconomic status or other factors. For example, patient A is from a higher socioeconomic background and can afford the treatment, while patient B is from a lower socioeconomic background and struggles to afford it. In order to ensure horizontal equity, both patients should have equal access to the treatment regardless of their financial circumstances. This principle ensures that individuals in similar medical situations are treated equally and do not face discrimination based on their ability to pay. Approaches to achieve equity include intervention, where targeted actions counteract systemic disparities through policy changes, resource allocation, education, and awareness campaigns. This dismantles barriers in areas like education, healthcare, and employment. Community participation involves involving affected individuals in decision-making, addressing local disparities through collaboration, empowering marginalized communities, and ensuring relevant and sustainable equity measures. Advocacy strategies raise awareness, challenge discrimination, and push for systemic change through campaigns and media engagement. Partnerships foster collaboration among stakeholders like government, non-profits, and businesses, pooling resources to address complex challenges. Environmental changes alter structural factors contributing to disparities by redesigning spaces, improving infrastructure, and ensuring access to essential resources. The organizational approach reshapes institutions by promoting diversity, eliminating bias in hiring and policies, ensuring equal employee growth opportunities. Policymaking enacts inclusive laws that counter systemic disparities in education, healthcare, housing, and employment, addressing historical injustices and discrimination. Last topic of this presentation is equity of access to healthcare, which ensures that all individuals have equal opportunities to receive quality medical services regardless of their background, income, or geographic location. This approach focuses on eliminating barriers that prevent marginalized or underserved populations from obtaining timely and appropriate healthcare. By addressing disparities in healthcare infrastructure, affordability, and availability, equity of access to healthcare aims to provide everyone with the same chance to maintain good health and receive necessary medical treatment, promoting overall well-being and reducing health inequalities in society. It lies on the 5 pillars: availability, adequate, accessible, appropriate, and affordable. Availability. Healthcare services and facilities should be present and accessible in all communities, regardless of their location or population size. Adequate. Healthcare resources should be sufficient to meet the needs of the population, including medical personnel, equipment, and facilities. Accessible. Healthcare should be easily reachable without facing physical, financial, or social barriers. This includes considerations for people with disabilities. Appropriate. Healthcare services should be appropriate and tailored to meet the specific needs of individuals and communities, considering cultural, linguistic, and social factors. Affordable. Healthcare services should be affordable for all individuals, ensuring that financial constraints do not prevent people from seeking necessary medical care. Dear learners, feel free to reach us for any queries. And at the same time, don't forget to subscribe and ring the notification bell to stay updated on our latest videos.